Good morning to one and all. Trends in prevention of cancer cervix. Cervical cancer is the most leading cause of death for female nowadays. So that in that topic we can have some trends in prevention of cancer cervix. I am Mrs. Arulmozhi, lecturer, Sri Lakshmi Narayana College of Nursing. Sad but true. In India, 200 women die each day due to cervical cancer. For you and your daughter, wonderful gift, God yourself means protect yourself. Very special program to prevent the cervical cancer. There is cervix in the woman. See, under the uterus, the cervix is both the side of the uterus body. Vagina enters to cervix, and ovary, fallopian tube, like that. This was the ovary. Sorry, cervix. This was a ovary. Fallopian tube. This one is a fundus where cervical cancer occurs in this area. What is cancer? Uncontrolled growth of abnormal cells in any part of the body, generally due to chemical, radiation, microorganisms. For example, chemicals is from smoking, microorganism, example, bacteria and viruses. Radiation through UV radiation, UV waves, UV rays, like that. Cervical cancer disease burden. Death due to cervical cancer in India, 1,30,000, worldwide, 4,93,000. See, this much India has 27% India has a cervical cancer cases in the world. Rest of the world, 73%. In India, 74,000 new cervical cancers is this one. Death due to cervical cancer is 74,000, 27%. Rest of these are other world. In India, it has 27%. How we far use due to cervical cancer and new cervical cancer cases, and then deaths due to cervical cancers. Incidence of women of all ages, cervical cancer versus other cancers. See, cervix, uterus, breast, oral cavity, ovary, esophagus, colon, rectum, stomach, leukemia, thyroid, like that. See, melanoma, skin and nasopharynx, Hodgkin's lymphoma, kidney, multiple myeloma, bladder, larynx, pancreas, liver, corpus luteum, like that. See, the annual crude incident rate per 10,000, 1 lakh population in India, female all ages having a cervix cancer. See how much, 26.2% it can occur. New cases incident is due to cervical cancers. High proportion of women are diagnosed at an advanced stage due to lack of knowledge among women of relevance of symptoms, fatalistic attitude towards cancer and possibility of being cured, lack of availability of healthcare in rural areas, low priority of women health issues. Due to low priority of women's health issues, they are neglecting the problem, whatever they have. Which health services sector? Decision on which health services sector to utilize for screening based on epidemiology, coverage of women at risk, use of maternal and child health, family planning services, occupational health services, mobile unit of screening, cost of screening in different health sectors. Epidemiology, we want to assess the incidence case and prevalence case, how much cases are affected due to cervical cancer. Coverage of women at risk who are after menarche, we should undergo the test, are above 45 years, 35 years. Nowadays, on 30 to 35 years, onwards, we want to analyze the risk use of maternal and child health or family planning services. Occupational health services, we should assess the how they are working, where they are working, under what much radiations they are working, or any other causes, chemical factories like that. Occupational health services, mobile units for screening of cervical cancers. Cost of screening in different health sectors to be commonized one. Human papilloma virus is the necessary cause of cervical cancer. See, 99.7%. Human papilloma virus 11, 6, 18, 16. This one is a human papilloma virus. Cancer causing types 1, 2, 4. 70% of cervical cancers, less than 75, sorry, greater than 75, greater than vaginal and vulvar cancers. Non-cancer causing types HPV6, HPV11, 96% of anogenital warts. Human papilloma virus, anogenital disease, cervix, vulva, vagina, anus, penis. Condylomata acuminatum, squamous intraepithelial neoplasia, and cancer. Head and neck disease, mouth, tongue, tonsil, sinus, oropharyngeal, respiratory mucosa, children, type of 6 and 11, cancer usually, human papilloma virus 16. Cofactors like smoking, alcohol. The natural history of human papilloma viruses, HPV infection. Here, HPV, human papilloma virus infection. Some cervical lesions will be there. It ranges from normal and this way it will move. And then development of pernicious lesion, CA1, CAN1, CAN1, 2, 3, like that. Invasive cancer, it can lead to cancer. See, the infection causing lesion will be there. Normal or pernicious lesion, invasive cancer, measured by human papilloma virus DNA detection in cervical cells. Relative frequency increase with severity of lesions. HPV infection to the cancer, Oractus, long-term use of hormonal contraceptives. Long-term use of hormonal contraceptive greater than 5 to 9 years, 3 times service. Greater than 10 years or more, 4 times service. Early initiation of sexual activities, early initiation of sexual activity, high parity, 4 times risk. Tobacco smoking, both active and passive, and then low diet poor in antioxidants. Other STIs are chlamydia, trachomatis, HSV2, immune suppression, HIV infection, multiple sex partners is causes the cervical cancer, human papilloma infection to the cancers. Cervical carcinogenesis, transient infection and persistent human papilloma infection. See, initial infection, normal cervix, HPV infected progression, or see, precancerous lesions will occur, invasion, cancer. Sometimes precancerous lesion, regression, human papilloma virus infected, mild cytologic abnormalities. This like it will be happen, and sometimes clearance. 3 steps of cervical carcinogenesis. Steps can be conceptualized as infection with specific high-risk types of human papilloma virus, progression to the precancerous lesion and invasion. Human papilloma virus infection are usually transient and are often associated with mild cytologic abnormalities. Persistent infection with high types of human papilloma virus is uncommon and is required for progression. That is, the steps are conceptualized as infection occurs. Infection occurs. Normal cervix human papilloma virus will be like this mild cytologic abnormalities in transient infection. Under the persistent progression takes place where precancerous lesion will be there, and sometimes invasion is called a cancer. If regression against, then clearance of these organisms. Human papilloma virus. Persistent infection with high risk type of human papilloma virus is uncommon and is required for progression. Natural history of human papilloma virus and cervical cancer. This is natural cervix infection. Sometimes it will be recurrent, clearance. Human papilloma infection, persistent stage will occur. Progression, precancerous invasion of cells leads to cancer. Whatever already we have seen, this one is that cancer invasion. If precancer phase, a regression occurs, clearance of these infection, HPV infection. By doing a coloscopy finding confirmed by histology examination. This was see the lesions and how the second stage and the third stage, how it will be. How human papilloma infection can occur. Through sexual intercourse, a vertical transmission, that is mother to child and fomites. Through the sexual intercourse, vertical transmission, that is mother to child and fomites. It is found that in every 10 women, 8 women might have human papilloma infection at any time in their life. Be aware of these symptoms: continuous vaginal discharge in spite of treatment, foul smelling, thick discharge, repeated vaginitis and UTI, post-coital bleeding, bleeding after sex, non-healing or recurrent cervical erosion, irregular or intermenstrual bleeding, especially in pre-menopausal phase. Cervical cancer screening, chronic pain will be there, distension will be there, loss of weight, heavy prolonged bleeding before or during a menopausal age. Post-menopausal bleeding is an important cervical polyp, tumor during or before a menopause age. Chronic pain will be there, distension will be there, loss of weight, heavy prolonged bleeding before or during a menopausal age. Post-menopausal bleeding is an important one. Cervical polyp, tumor during or before menopause age. It is possible to get protection against cervical cancer. Yeah. Cervical cancer is now visually preventable disease due to early vaccination, screening strategies, long natural history. Cervix is easily accessible. Secondary prevention. Screening may help in early detection and cervical abnormalities. What is the use of screening a program? Secondary prevention for screening a program are helpful in detecting the cancer at the early stage, hence useful in saving a life. Tests available: visual inspection, see, 4% acid test, villi test, Lugol's iodine, pap smear, HPV DNA test. Community low resource setting, this can be done. In still experiment, cervicography, PapNet, polar probe. This is now still experimental work. Nowadays, they are checking a pap smear, human papilloma virus DNA testing, sometimes visual inspection, and these two tests. USPSTF and ACS, ASCCP, ASCP guidelines at glance. Population younger than 21 years are recommends against screening. Grade D recommendation. Women should not be screened regardless of age of sexual initiation or other risk factors. 21 to 29 years recommends a screening with a cytology every 3 years, a recommendation, grade A recommendation. Screening with cytology alone every 3 years is recommended. 30 to 65 years recommends a screening with cytology every 3 years for women who want to lengthen the screening interval. Screening with the combination of cytology, HPV testing every 5 years, grade A recommendation. Screening with the cytology and HPV testing, co-testing every 5 years, preferred, or cytology alone every 3 years, acceptable in recommended. United States of Preventive and Services Task Force, ACS, American Cancer Society, ASCCP is American Society of Colposcopy and Cervical Pathology, American Society of Clinical and Pathologists. And guidelines at a glance, older than 65 years recommends against a screening of women who have had adequate prior screening and are not otherwise at high risk for cervical cancers. Grade D recommendation, that is grade D recommendation. Women with evidence of adequate negative prior screening and no history of this within last 20 years should not be screened. Screening should not be resumed for any reason, even if a woman reports having a new sexual partners. Human papilloma virus vaccinated women who have been vaccinated should be continued to be screened. Recommended screening practices should not change on the basis of human papilloma virus vaccination status. After hysterectomy, recommends against the screening of women who have hysterectomy with removal of cervix and who do not have a history of high-grade precancerous lesion, cervical cancer, that is also grade D recommendation. Women of any age following a hysterectomy with the removal of cervix who have no history of CIN2+ should not be screened for vaginal cancer. Evidence of adequate negative prior screening is not required. Screening should not be resumed for any reason, including if a woman reports having a new sexual partner. Pap smear test. Pap smear is a sampling of cervix, involves scraping of cervical surface and a portion of non-visualized cervix canal using a various sampling devices. Disasters prevention is better than cure. Hold true for cervical cancer. See how the pap smear is. See how the pap smear is checking. Cervix viewed through speculum and with the patient with lithotomy position. Here we will take a This can be achieved by regular health checkup and regular pap smear test. Pap smear is a cancer screening which is easy and painless and reliable method in which the discharge from vagina is taken on slide and sent for examination for the presence of abnormal cells. Routine pap smear has reduced cancer cervix by 75% in developed world. Repeat pap smear is advised if shows abnormal cells, then advise colposcopy and biopsy. It can give early diagnosis of cancer before it sets and hence early treatment can be avoided. Avoid diseases. Significance of pap smear: detect the precancerous and invasive cancer cervix cases in early stage. Positive screeners can be selected for selective test and management. With the treatment, progression of disease is halted. Thus, morbidity associated with advanced cancer decreases, mortality reduces by 20 to 60%. Help us to study a natural history of disease. Transformation zone, see how it will be transferred. Cervix developed from two embryonic sites from Mullerian duct lined by columnar epithelium, from urogenital plate lined by stratified squamous epithelium. Point at which corner and squamous epithelium meet is called as original squamous corner junction. See, this is a corner junction where canal of cervix, tall corner cells, flat squamous cell here. But this one is uterus. Transformation zone under influence of estrogen, original SASJ moves into possia. Exposure of declined corner cells to vaginal environment leads to squamous metaplasia. Transformation zone, area of squamous metaplasia, area between original and new is squamous columnar junction. Transformation zone, see, ectocervix, this one. Metacervix, mild color. Endocervix inside. Negative squamous columnar junction. Squamous columnar junction. A method of identifying outer and inner borders of transformation zones. Transformation zones, most distal cervical crypt opening, newest squamous columnar junction. Original, this one is original. Area of columnar epithelium, area of metaplastic squamous epithelium, area of original squamous epithelium, most distal cervix crypt opening. This one, small white color parts. This one is transformation zone, where it transforms. Transformation zone, expose of transformation zone to carcinogens begins the process of intraepithelial neoplasia. Right? While exact role of carcinogens in this process remains poorly understood, it is clear that human papillomavirus and cigarette smoking can cause dysplasia. 95% of cervical cancer developed in. Important to take a sample from transformation zone. Pap smear, the cells are taken from the cervix region by speculum and then smear is prepared with which is then observed under microscope. It is not recommended in a virgin females, recommended in every 3 years to the people aged more than 30 years. How to take a pap smear? See, the scapula is rotated to 360 degrees Celsius. Maintain a contact with the ectocervix. Do not use too much of force. Bleeding pain will occur. Do not use too less force. Inadequate samples. The sample is smeared evenly on the slide and fixed immediately. Both sides of scapula are to be smeared. How to take a pap smear? See, endocervical sample is collected using the endocervical brush. Insert the cyto brush into canal so that last bristles of brush are visible, and rotate the brush through 180 degree. More rotation increases the chance of bleeding. Sample is rolled on the slide of the slide fix. Fixation of smear. Fixation is done immediately with the fixate of 95% of alcohol and spray to avoid aggressive Air drying spray should be kept only 10 inches to avoid destruction of cells by propellant in spray. Smear should be monolayer for proper penetration of cell structure fixatives. What is the HPV test? The HPV test is very accurate way of tell if high risk HPV is present in a human cervix. This test can be used the same sample of cells taken for HAPS test. A positive test result means a woman has high risk human papillomavirus. When should a human papillomavirus test be done? To see if woman with a borderline pap test result, one that shows an unusual cells but not a dysplasia, needs additional test. To screen for cervical cancer along with the pap test, a woman aged 30 or older. Coloscopy, magnified visual examination of uterine cervix by the low power stereoscopic microscopic with powerful light source to help in diagnosis of cervical neoplasia. Key ingredients, observation of features of cervical epithelium after application of normal saline 3 to 5%, dilute acetic acid and lugulose iodine solution. Coloscopy objective determines the presence of invasive cancer, localize as squamous pulmonary junction, identify the most severe disease for biopsy, evaluate the extent of diseases. Grading abnormal coloscopy finding using two categories, insignificant and significant. Source of findings, dense, aceto-white or gray opaque epithelium, sharply bordered. Aceto-white epithelium is usually shiny and semi-transparent. The borders are not sharp, with or without fine caliber vessels. See, shaped and coiled vessels, irregular shaped and coiled, dilated caliber. The entire new squamous pulmonary junction is visible. Coloscopy examination satisfactory. TZ is fully visualized the metaplastic squamous epithelium is pinkish white compared to pink virginal squamous epithelium. The post-menopausal cervix shows a subepithelium petecia squamous columnar junction not visualized. See, coloscopy finding confirmed by histology. Carcinoma Institute. See, this one's early invasive procedure. Invasive cancers, not the raised irregular mosaics with amplification, breaking of see, this one is a amplification, breaking of mosaics be surface irregularly and atypically. This one vessels after application of 5% of uterine cervix, reddish angry looking inflamed columnar epithelium with the loss of villus structure with inflammatory exudates. Chronic cervicitis, the cervix is extensively inflamed with the reddish appearance and bleeding on touch. There are still defined a patchy aceto-white area scattered all over the cervix after the application of A. TB after lumbols. Trichomonas vaginitis collectus after application of Lugol's iodine, leopard skin appearance test. TB after acetic acid, multiple red spots, suggested Trichomonas vaginalis. It is in strawberry appearance like ... It will be. See how the human papilloma vaccine will be. Vaccine should be 0.5 ml pre-filled syringe. Human papilloma vaccines made up of recombinant DNA technology. Indication for Gardasil for the prevention of cervical cancer, vulvar or vaginal pancreas, cervical dysplasia, genital warts. Cervix is only indicated for cervical cancer. Effectiveness: Gardasil vaccines efficacy in 98 to 100%. Cervix vaccine efficacy is 92 to 94%. Effectiveness, vaccine efficacy like that. When we can give this vaccine can be given at any age above 9 years, recommended for women 9 to 45 years of age. The most effective time to vaccinate girls and young women is before they become sexually active. How many doses recommended? 3 doses are recommended. First, as elected date. Second, after 2 months of first dose. Third, after 6 months of first dose. Elected date, 2 months, 3 months. Side effects. HPV vaccine demonstrated as a favorable safety profile. Following injection site reaction occurred at the greater incidence in the group that received vaccine. Very common erythema, pain and swelling. Commonest pruritus. Most injection site reaction were mild and moderate. Special attention. Special pap because pregnant women because of insufficient trial, there is no recommendation of vaccine in pregnancy. If woman gets pregnant after first dose, then remaining doses should be taken after delivery. Lactating mother can take this vaccine. Cervix is not most indicated to this location. Lactating women can take this vaccine. Cervix is not indicated during the lactation. This vaccine is costly. No, if we can see the mortality rate of cervical cancer or its treatment, vaccine cost is nothing against. If we see the modern lifestyle of people, vaccine cost is nothing. People give a lakh of rupees dowry to their daughters. Vaccine cost is nothing against it. It is a cost-effective one. And yes, this vaccine is available in 156 countries till date, 200 million doses already used within 9 years of time. How the vaccines are worked out in every country, where and all they have. The vaccine that has reached millions of people in 106 countries can now make a difference in their life. But the primary prevention is most important one. Social change, avoid early marriage, multi-parity, role of family planning, avoid multiple partners, use condom to avoid sexually transmitted disease, human papillomavirus disease, improve nutrition and personal hygiene, prevent smoking, alcoholism, regular exercise, health awareness, health checkup. To reduce a cancer-free society, screening and identification of high-risk group, education, thinking of cervical cancer as an extension of sexually transmitted disease, behavioral changes, limit number of sexual partners, delay initial age of sexual intercourse, avoid STD, use of condoms, spermicidals, avoid smoking, HPV vaccines to be promoted at right. Let's fight against cancer. Join hand, take up preventive measures, update yourself, take care. Thank you all.